Okay,
Is
maybe you want
that
to
the
name two things?
longest we've not talked in a podcast?
Welcome to another episode of NUHS Care to Talk podcast, where we talk about all topics about healthcare from head to toe.
And today we have Mega with us
Hello.
she's a nurse from the NUHS Regional Health System Office.
Nice to meet everyone.
So great that we have you here because I need you to help settle a debate between myself and Mildred this morning.
Yep.
She asked for a mental health day off tomorrow, and I'm like, what in the world is a mental health day off? I mean, for thousands of years, humans did not need a mental health day off, right? We just got down to work and continued on. So what in the world? Is it some Gen Z slang or what?
Okay, first off, back in the day, people were struggling probably didn't take a day off or something. But I mean, I might look fine on the outside, but in my head, it might be messed up. You never know.
Yes, you are right. Actually, you were not able to see that, right, from your facial expression alone most of the time. With a mental day health, I also would like that if I can. I think it does help people, to just have a rest, just to go out with your friends, family, just have a day off, just enjoy yourself. Then that's where it really help. Like even in our working environment in NUHS, we also encourage, right, our staff to take every 3 months, please take a leave, go rest, okay, go have a good time for yourself before you come back to work.
Yeah.
So how do you differentiate those that really need a mental health day off and those who are chowking, so to speak, just pretend to feel a little sad and just, I want to go and spend time with doing whatever.
Okay, actually it's very difficult to differentiate because this is really your own feeling, right?
I guess there's some people who just say oh, I'm so depressed. It's like, how seriously should we take them?
So I think the importantly is to listen to them, okay, to understand a bit more what does she mean by this depressed right? Depressed can meaning a lot of things. Really to provide this listening ear to them, okay, to try to understand more a bit on detail, right? Then from there, we can assess, right, what is the support they need and whether really need a day off, whether mental day off or not, is whether do they need a rest .
Are there actually any interesting cases that you've come across, in your experience at the community health post?
Okay, so I do have I say many, okay, but one of these that I can remember very strongly is that there's one day that I went to one of the resident house, okay, mainly is actually because the elderly mother actually has dementia. So just discharged from the hospital. Then, inpatient asked the nurse, hey, please go in just to check how are they coping, right, with this resident at home with dementia. So when I went in, right, actually one thing that shocked me, when I just want to talk about, how's your mom, at home coping? So actually suddenly tears in front of me. I was not sure what happened. Then I trying to give time for her to express, to tear, to cry. Then subsequently she actually opened up to me that, she feel very stressed. She has to take care of the young children. She has to take care of the elderly mother.
Yeah.
Then no time for herself. All that time already spent to the caregiving roles for both of them, right?
Yes, yeah.
I remember so strongly because that's something I'm very shocked trying to find tissue paper also. Yeah. So from there, you see, I see that she really struggled, right? That's where I think it's maybe because it's at home also, at her own family environment when she willing to open up to me, right? Rather than whether in the hospital also. Yeah. So then what happened that she then tell me, Mega, actually I'm very, very stressed, My work has been affected. My boss want to sack me. Wow, I hear that, okay, then how? And the alone breadwinner maintaining that some more. Wow. Then there's also factor of how is it the coping that that is caregiver stress technically. Yeah. So then she actually tell me that actually I very exhausted. I got anxiety issue myself. I actually feel very guilty. I don't know what to do. Guilty to my children, no time for them. Guilty to my parents, because don't know what to do. You see. Yeah. So I think this is make me think more. Actually, maybe there's many other out there that experiencing this, okay, that you may just not know.
So, Mega, just clarify for us, right? Why do we have nurses going to a patient's home suddenly? I thought either they come to the community health post, or the hospital.
So currently in the NUHS, right, we name ourselves as a community care team, which is known as CCT, right? So our role here actually multiple. One of the role is that we go into people's house, that where we provide the assessment at their home itself, at where they live, so we can see more about how they really coping in their own family environment. That's number one, right? And provide some assessment of whether medications or even that's how the 4 risks that most of them they refer to us. Second, we also will go into the community health post, which is known as CHP, right? That's just around the neighborhood corner. So we will station ourselves there, okay, that provide this easy access for the resident who stay around there. So they can just come down, okay, and see us. Megawati, I got this concern, or my colleague who are stationed there, right? Yeah, then we can provide accordingly, whether some mental health information or even initial mental health support, right? That's the main thing when we are doing lah. But definitely we also have supporting some wellness event or programs that NUHS run actually for most of the time during the year, right? Okay,
Yes.
so that's where we provide our support also. It's really about preventive health, okay, maintaining your chronic disease, your mental well-being, and also providing support. All this is our role.
But okay, so not everybody though will come to you and cry. Like you mentioned, it's quite hard to spot those who refuse to converse or open up, you know.
Or suppress their feelings.
Yeah, suppress
right?
their feelings, but
Yeah.
you know, what if, you know, it's someone who's a bit more stoic and refuses, you know, to show outwardly? Are there any signs that you can spot, or any kind of behaviors that you can say, hey, you know what, this is a little off? I mean, yeah.
Yeah, actually there is, warning sign, the early warning sign that can spot. But as you said, sometimes it's very subtle only, or can be easily dismissed, by the people. Maybe one thing that maybe you'll notice that they may complaining, oh yeah, I got always persistent headache, but when they went to see doctor, nothing that being found, they got any problem. Or maybe I just always have stomach problems, my appetite now, sometimes like getting no appetite. Or maybe I see my immune system not so good, getting cold more often. This is all simple thing that we all have also, right? It's so subtle that you may just dismiss it, you see.
Yeah.
Yeah. So there's other things that you may notice also, whether with your mood. So it's just that, previously I like to do activity A's. Now I don't like. That's very sudden. Am I right? Yeah. Then I now don't like to go out. I just want to stay at home. Yeah, this is all the warning sign that you may see.
Yeah.
Right. But sometimes very common, I'm just very, very tired. But how you know? So this is possible, the early warning sign. Or maybe just say, now my sleep not so good. Right now, even I sleep well, maybe I sleep 9 hours, but in the morning I always feel very tired.
Yeah.
That's also maybe the sign, you see.
It sounds like a lot of signs like that speaks to me of Mildred. She likes to sleep in.
Really?
I don't want to go out. I asked her for badminton.
Who does not
rejected.
like to sleep in? Because I was playing tennis, by the way.
Yeah.
Yeah.
Okay, you
just
deserve that
covering
mental health
myself,
break. Alright.
Correct. But definitely you see that it's possible. It's just a real reason that after a day of very tired outside, then you just want to rest. So it's really important to understand more, But definitely, as I mentioned earlier, build rapport is very important. Not all want to open to someone stranger that you meet first time, right?
And I suppose also it's down to the family and friends to keep a lookout, I guess.
Yes, definitely. Yeah, I think family and friends is very important because that's where we spend our time most when we see them, right? Whether at home, whether even your colleagues. Sometimes they may be the first one that notice as you spend most of the time at your work.
Do you see that there's a
Rising trend?
rising
Is
trend
that-
of people who are struggling to with mental health issues?
If you notice that in Singapore itself, if we look at statistics, there's this 2022 study actually found that 1 in 3 people in Singapore actually experience mental health issue. That's like 35% of it.
Yeah.
Okay, that's
So
actually
wait,
quite
so
a
that
lot.
means out of us,
Maybe
statistically one of us. Okay.
may have, right? Yeah. So that's actually show the possible trend, rising trend. However, with recent coming years, there's multiple support programs actually. Yeah, whether in the communities, that to support people with mental health concern. So I think that is also the reason there is this news that mentioning that more people are willing to seek help, okay, rather than keep it themselves. But seeking help also doesn't mean that, it will be okay, right?
Right.
Yes.
Yeah, because as you notice, okay, maybe we just mentioned like us lah, working adult, right? Actually, we face with a lot of challenges, right? Whether that hitting us all at once.
Yeah.
Whether like your high working stress level, then combined with your own personal challenges of major life goal, like maybe getting married, buying a homes, with Singapore high expensive rental costs, living costs.
Very sad.
Yeah. So all this actually compound together, right? That causing all this pressure. But how you balance it also very difficult. Whether it's your family expectation, social expectation, then you are struggling right here to meet that demands. Yeah. So it's really not easy.
In your dealings with the public, right, do you feel like they have some misconceptions or misperceptions about mental health issues?
Many.
All right.
Yeah. How many you want me to give you?
Maybe the top three.
Top three.
Yeah.
Okay, so maybe the top three. First, that I always hear, mental illness it's just about a choice lah. Oh, because you are weak, that's why you have this mental health problem. But actually, this is not true, right? Yeah. So as it said, this mental issue actually is caused by really medical problem lah. Whether it's can be just your trauma, also genetically does affect, right?
Okay.
But the important thing here is that it is not a character problem, right? And all this actually require treatment to help. So the second misconception that I always heard is that, it's just for attention lah. Like, like their parents, it's just for attention only. But actually, that is also not true. As we mentioned, many people actually will just want to hide their this
True
struggle,
feelings, right?
right?
Yeah.
Feeling. So if they really reach out to you, right, then technically they're actually genuinely in distress. Correct? Then they really need support. Yeah. So this is a second misconception. Maybe the third one is one that only psychiatry can help me if I got mental health illness. I have to go to IMH example. But actually technically not true lah, right? There's other people that can help you just in the community, whether it's just counselor or maybe just some community support group or even just a GP around your house.
Right,
They're able to
okay.
help you with that.
How so? How will let's say a GP be able to help you with that?
Okay, so actually when you go and see a GP, as currently the GP is they are trained also like to review all these mental health issue, then they will assess accordingly and maybe they will refer you to some community support to help you with that, right? They provide the initial screening I think that is more important.
What actually is the right mindset to have towards mental wellness?
Okay, I think the important here is we should normalize, right, this mental health check-in just like your normal physical annual check. Yes, even when you are feeling fine, right? I think this is important because we want to reframe, right, this mental health care as a preventive maintenance rather than the emergency intervention. When you have that, then I go. Right? Yeah. So I think that is the important portion about this. But how do we then do that? Right? I think that is very important. So we need to change how we think about this mental health in the community, right?
Yeah.
We cannot be expecting people just say, okay, if you've got this problem, you just push through these tough times alone, right? You actually importantly is to encourage and support when they're seeking help, right? And we also have to educate, make sure that getting mental health help, right? So be seen as a responsible way smart way to do. Like then we need to shift our thinking to break this crisis only mindset really from our reactive to proactive mental health care, right? Then just like your physical fitness you shouldn't wait until you're very distressed then I go and think about my mental wellness.
Yes.
So you must treat it mental health as a ongoing self-care, right? Rather than emergency intervention.
Got it.
I think finally, maybe could you just share with our viewers something that they can do, something simple that they can do to help with their mental health?
Okay. So there's this very simple exercise Maybe you can do it with me together also.
Okay, sure.
Actually, I call it 3, 2, 1.
Okay.
That's very easy to remember.
Okay,
right?
let's try it.
This is just a daily check-in.
Yes.
So what it means is that the 3 is meaning that take 3 deep breathing.
Okay.
2 is to name what you feel at this current moment, what you experience.
Right.
And 1 is to name what you feel grateful about just today. Just as a simple thing, just now I'm having my tea, right? Yeah. We want to start to do it together?
Okay.
All right.
Sure.
Okay. So maybe we start with the 3, deep breathing
3
first.
deep breaths,
So what
okay.
I did, you take a slow deep breath in, hold for 2 seconds, then breathe out.
Okay.
Repeat the cycle 3 times.
Okay,
That's it.
let's do it. Okay.
1, 2,
2,
3.
go.
Okay,
Is
maybe you want
that
to
the
name 2 things?
longest we've not talked in our podcast?
So 2 things I'm feeling right now. I am feeling a little sleepy post lunch. I am also feeling quite calm. Yeah,
It's great.
yeah.
That's a good thing.
Amazing.
How about you?
I would say that I'm feeling. Oh dear, I'm still struggling to come up with an adjective. But yeah. Oh dear, maybe I would say maybe even nervous. Slightly nervous because, yeah, I mean, we're on camera and this is us talking. It's a podcast. I'm being really honest right now, guys. Yeah, but also happy to be in the moment right now.
Okay,
Yeah.
that's good. Actually, one of my feelings same
Conflicting.
as you. I also feel very nervous first time
Oh,
in
no.
the podcast,
Same.
right? With the
Okay,
camera
okay.
rolling right now. Okay, yeah. But the other feeling that I have here, actually, I feel relief. Yeah.
Because we've come to the end of the.
Yes, it's come to the end, and I think it's also because I managed to share, about this mental health with our audience also lah. Yeah, so for them to understand a bit more.
Right.
Yeah. Okay.
Yeah.
And the last one is what we are
Like
grateful
one
for,
thing,
right?
Correct.
right? Yeah.
Okay, you want to go first? I mean,
Oh,
I don't
me
want to take
going
all the good
first?
stuff.
Oh, okay. Grateful that yeah, I think I had a good breakfast, had good lunch. You see, it's all very food centered. Sorry.
But that's nice thing.
Yeah, and I'm really looking forward to a cup of tea after this.
I also want that. Let's share together.
Right. I'm grateful for a wonderful guest.
All right, trick
Right,
question.
suck
Trick question.
Yeah, wonderful guest. Great sharing. I think, you've been wonderful today. And it's been very easy talking to you also. So, yeah.
Oh, yeah,
Great.
thank you so much. I feel shy. Okay. For me, one thing that I feel grateful about today is that I kissed my 2 kids. Yeah, before I go to work. Yeah,
Love
I think that's the
Nice.
things that
I
I'm
love
grateful about for
that, yeah.
today lah.
Right.
Yes. Yeah. So you see, that's just as this. It's easy, right?
Yeah,
You
yeah.
don't need even to track. I don't need to do any writing down. So this is just a very simple, quick check to take a pause of yourself, to reflect, to think on yourself, how you feel today. Yeah, you can do it anywhere actually. You can just whether before you sleep, whether you're at workplace, at your desk, or even on the bus. So easy.
Thanks so much for joining us, Meg. It was really nice to have you on.
Most welcome. I'm nice also to be here.
Nice. Okay. Yeah. All right, guys. So remember, try the 3-2-1 daily check-in. Have some thoughts. Write them down in the comments below.
See you on the next episode.